All, my name is Anna Reed, nicknamed Nonny for those who don't know me. I'm a transplant pulmonologist working at Harefield Hospital in London, and I'm the current chair for possibly only a couple more months until the annual meeting of the Pulmonology Council. So welcome to everyone. Despite being in London where it's raining, I'm in the hottest room, so I'm a bit flushed and I've had a busy day, but good to see you all. Would other members of the Pulmonology Leadership Group like to say hello? Introduce yourself. We're a friendly bunch and we're very pleased to get more people involved and interested in the work that we're doing on behalf of the Society. Josh, I can see you to my left directly there.
Yep, sure. I'm Josh Diamond. I am a transplant pulmonologist at the University of Pennsylvania, and I am on the Leadership Advisory Forum.
And I'm Brian Keller. I'm a transplant pulmonologist and medical director of the lung transplant program at Massachusetts General Hospital in Boston. I am the pulmonology professional community representative to the advanced lung failure and transplant IDN.
Anyone else? Caroline, you're hiding there.
Sorry, no, not hiding, just need childcare. Sorry, forgive me. Yes, hello, I'm Caroline, a transplant pulmonologist from Cambridge, Royal Papworth Hospital. And I was the erstwhile advanced lung failure IDN chair, relinquishing my post to the far greater Brian. So, welcome.
Okay, so there's a few of us here now. So I think the main kind of reason for having these meetings is to really try and connect as a physician group, to try and hear from people who are interested in getting more involved, to let people know what we're doing. So we've got some slides that Juliet has very kindly put together about sort of statistics of membership of the society as a whole. Also looking at how many pulmonologists there are. But I think from my perspective, I'd be really interested to hear from people who've joined the call as to what it is you want from this group. What do you need? What can we do as a sort of leadership group? How can we get people more involved? I think that's a perennial question. I'm looking at you, Greg, there, to sort of how do we get people to step forward? There's a lot of work to be done. It's all done sort of on a voluntary basis, and we all appreciate that. But it's often very exciting. It's a good opportunity to connect with people. So do people have issues that they want to raise, or things that they're keen to bring to the table, things that they're keen for us to work on more as a community? There must be someone who's got something to say. Chiara, I can see you there.
I always have things to say. This group knows that. I mean, I think the thing that I keep hearing from people in our heart and lung programs here is younger members, or people who should be members, still don't feel like they know what they should do to get involved. I think the people I've interacted with have had good success sort of signing up to be an abstract reviewer.
Yeah.
And have, I think, gotten that far. But like even like several of our junior faculty didn't get the message, didn't get the link to sign up for the working group consensus document things for, for heart and lung. So I don't know if that's an interface thing that people aren't getting it, or if emails are going into spam folders or what, but I think that's the barrier. I know lots of people who really want to participate, but still can't figure out how. Which I think is, like, I mean, yeah, there's dues and price and all that kind of stuff, which I think we've talked about before, but that's the barrier. They're frustrated that either they don't know what to do to get in, or you go to an early career meeting or something like that, and they say, sign up here, and then nothing happens to that and they get discouraged that they weren't offered an opportunity, or, you know, and I actually think more than other societies I've been part of, ISHLT is much more deliberately dedicated to inclusion of junior members in meaningful roles. And I think even with that, it just something, there's a disconnect. And like, I have a lot of trouble with ISHLT Connect. Like, I can't open it on my phone. The links don't always work. I think it's hard to find what you're looking for, even if you know it's there. But I don't think that. So I guess that's I think, to me, the barrier of getting people, like new faces. Like, the volunteer list is always the same people.
I agree.
They're great people, but it's always the same people.
Yeah, and there comes a point when you can't take any more on, no matter how interesting the project. No, I completely agree. We've looked and talked a lot in this group about how to sort of engage people more on a personal level, and the obvious place to do that is at the annual meeting. But again, it's how you kind of create, and I think online is difficult. We've all had to move to online. We're all better at online, but it's difficult for people to feel empowered to speak up, especially when they don't know who any people are. We certainly try and encourage our junior members that we work with, but again, it's difficult then to get people to come to meetings if we're in the UK and the meetings are in North America, for example. So I think it's very difficult. I don't know, Greg, what other groups are doing.
Well, first I'll say that is the most common question that we get. You know, how do I get more involved? That is definitely the number one issue that I want to solve. And I think there are, I think both of the sort of obstacles, first, communication, to make sure that we're getting the messages out to people and there are links and such. And then it is follow through, and making sure that we follow through when somebody raises their hand. We had the call for committee positions a few months ago. We received over 260 applications for about 25 positions. So there's a lot of competition. And our challenge really is for all of those folks who raise their hands and say, I want to get involved, to figure out something else so they don't become discouraged.
Yeah.
So I don't know of a magic bullet, but I do know that it's my number one and number two questions and challenges and goals is to make it clearer how to get people involved, how people can get involved. That abstract reviewer is a good entry spot for sure.
I'll say one of the things that Chat does quite nicely is actually reserve spots on, they're called networks through Chest. So there are always 2 fellow spots that are reserved for folks within each network. So I'm the vice chair of the transplant network at Chest, and every year there's a new fellow, somebody rotates off. So it's a nice opportunity for a trainee to get involved. Greg, one of the things we talked about at the leadership meeting down in Florida a couple weeks ago was how to get those junior folks excited. So sort of reserving spots on committees for trainees, not just early career folks, but trainees, is potentially one way of going about doing that.
That's a great idea. And, historically, we haven't distinguished between trainees and early career. We've had early career, all the committees have an early career spot, but not a trainee spot.
Greg, I think I would also just point out there are a couple current opportunities for membership at large to get involved. Kira mentioned the S&G, the call for participation in the S&G guidelines. So that's definitely an option. And as everyone knows, we do try to have a diverse group of people in those work groups. So early career, later stage, different parts of the world, different mixes of people. The other one that may have slipped under the radar is the advocacy committee for ISHLT is currently asking for input on some of the Organ Procurement and Transplantation Network, or OPTN, documents that went out into the public comment period. And so that is a way to put your comments down. You can also specify if you want to be, you want them to contact you to follow up if they have additional questions. But that's an easy way, I think, for people to get involved just by reviewing, one of the documents and submitting some comments.
Yeah, and I think
Sorry,
Sorry.
I was going to say if I could add a comment. Sorry, I'm invisible on site. But all I was going to say was I think what you've really hit home is the fact that the people who we want to come through, who are going to be our replacements in the future, there's no place for people who are not currently members. And I guess one of the things I wonder about, Greg, is whether there's scope to involve these people more, because certainly, my current trainee really wants to become a transplant physician in the future, but doesn't want to spend 600 or 800 pounds a year.
Yeah.
To then to have access to being involved in things like the consensus document. So I guess perhaps one of the things we need to think about in the future is how can people access a society without paying the full membership or, having to fork out from their own pocket for a career they haven't 100% committed to yet?
Yeah, that's another hot button issue and came up at the leadership meeting in Florida. And we've opened the door to that a little bit in that non-members can participate in ISHLT Connect professional communities, and they can attend webinars and they can present on webinars. And then there's the membership, door above that for further engagement. But we've talked about ideas like to reach those trainee people, those medical students who have not yet made a commitment for exactly those reasons. And maybe there should be a free membership up to a particular age, or those kinds of ideas are being talked about as well.
I think that's so important for future kind of
Yeah.
planning for us as a community as well. I think recognizing that there don't appear to be sufficient physicians and surgeons coming through to fill the requirements, then actually that's such an important role that we can have to try and make the community sustainable.
Absolutely. Yeah, I mean, and it's connected, right? Workforce issues, along with creating a pipeline of ISHLT members and leaders. It's all connected.
Yeah, no, I completely agree with that. I was just going to share some of the slides here that Juliet kindly shared. I don't know if you can see my screen. Yes, no? Can't hear anyone anymore, so
No.
I'm going to... No.
It's
Not
sharing.
yet.
It's starting to share.
There you go.
I think you can see all of us. I was going to go down to some of this data was really quite interesting looking at. So we've recently in the structure of the dues and the tiers, I think over previous years we've talked a lot about how we get involvement from non-physician, non-doctor members of the team, and it's one of the things I really value about this society is the truly multidisciplinary nature that, we have nurses, we have physios, pharmacists, psychologists that really have a voice, and that represents, I think, the clinical practice of transplant and MCS medicine. So I think it's very, very important. But we've certainly got significantly higher non-physician members now. So that seems to have worked quite well. You must be pleased with that, Greg.
Yes, that as you can see, our that exceeded our expectations quite dramatically.
Yeah. And if we then go to have a look, where is everybody joining from? It's still predominantly North America, some Europe, and then smaller numbers. Is there anybody here from outside Europe or North America today? No. Okay. So, okay, then there's a few dates. I might come back to the issue of junior membership. I'm sure you did discuss it at the leadership meeting. I have some ideas, but maybe I can discuss that later at a later stage. So in terms of Prague, I hope you're all coming. I'm not sure how it usually works out with attendance from different places when it's in Europe rather than in North America, but certainly we've got a much bigger group coming from the UK when it's in Europe. I'm wondering how it's going to go for the Sydney meeting, but they always make a huge effort to the Australians to come to the meetings wherever they are. So hopefully there'll be a good turnout. So just to highlight a few dates, for the diary. So Friday, the 12th of April will be the advanced lung failure meeting. I think there's probably quite a lot of people in between pulmonology and advanced lung failure. And then the pulmonology meeting will be on Thursday. So hopefully people will have a good turnout for those meetings. Greg, do you have a kind of idea of what you hope to achieve through those kind of networking events?
Well, the IDN meeting, the advanced lung failure meeting, that'll have the interdisciplinary, the multidisciplinary focus, and talk about the IDN's goals and objectives in the coming year. And then the pulmonology meeting, I hope that it's an expanded version of this, where we're actually able to talk about specific issues about how to get more people involved in the organization and what are the kinds of things that pulmonology would like to bring up to the multidisciplinary IDN steering committee, standards and guidelines documents, annual meetings, symposia proposals, and workforce issues. What are the issues that ISHLT could address that would engage this group and provide value? So I'm hoping it will be, and some socializing as well, so people get to know who else is in the organization.
Fabulous. Okay. I'm just going to stop sharing there. So, sorry, somebody was saying something. No, is that Damien? Are you waving, or is that just your screen? No, it's my hand there. So has anybody got anything particular burning issues they want to raise today? I'm going to start asking specific questions. Cyrus, you're new to me. I don't know who you are or where you work.
Hi, I'm a pulmonary fellow at MGH. I received an email inviting me to join for this town hall today.
And
excellent.
Thank you for doing so. I mean, that's exactly what we asked people, who are the people, we asked the leaders of the community, who are the people who should be present for these conversations? And your name was one of the dozen or so that were submitted. So really appreciate your taking the time. What can we do for you?
Yeah, that's exactly what I was going to ask. We're going to put you on the spot. Do you have a career in transplantation? Are you committed? What do you want from us as a society? And how can we kind of facilitate, opportunities, training, things that are interesting?
Yeah, absolutely. I mean, I really appreciate this invitation. And I'm finding this very valuable because I'm planning on focusing on transplant next year. And then hopefully my career will start from there after I graduate. And I really appreciate hearing about kind of how you're trying to build opportunities for early career and trainees. And that would be my specific interest if I was explicitly asking for one, is kind of ways for me to get involved now that can help just me see what I could do as I eventually transition to early career, to be more involved in the community and to be kind of on the cutting edge of kind of the topics and discussion points.
And do you feel more able to put yourself forward for stuff now that you've met us, you've talked to us, and you've seen what we've got to say? Will you put yourself forward? I think as somebody who took a while to warm up to my involvement in ISHLT, I think it's fair to say that the minute you get involved, you get very involved very quickly. There's a lot of opportunities. There's a lot of work. There's a lot of networking, which is fun.
Well, absolutely. I mean, it's nice to see how friendly you guys are. So that certainly makes the barrier lower than wherever it was before. So.
Okay, so we'll feel it was definitely a success to invite you today. So there's a few other people I don't know. Erica, I'm afraid I don't know you either.
I'm Erica Least. I'm the medical director of the lung transplant program at the University of Washington in Seattle.
And past chair of standards and guidelines.
You see, I have, like I say, I was only got involved recently. Otherwise, I'd know who you are.
It's okay. Nice to meet you.
And you, Elias, you've appeared. I'm hoping that means you've got something to say.
Oh, nothing. I was just expecting to be called on.
Okay, great.
I am a pulmonary critical care physician at Duke. I am not involved in lung transplant. I'm here because Lorenzo Zafiri is a good friend of mine, And I think I'm supposed to be a bridge to the ECMO community. So I'm an ECMO researcher at Duke, and he said he's trying to build bridges with ELSO. So Craig Rackley, who is not here, and I think are going to serve as maybe part of that bridge.
So that's fabulous to have you here, and it's certainly something we've discussed a lot. Obviously, as a community, we use a lot of ECMO in all sorts of different guises, and one of the things we're trying to do as a broader community is to connect with groups such as the ECMO groups, the advanced lung disease groups like the CF Foundation, etc. So, very good to have you on board. Have you ever been to one of our ISHLT meetings? Would you consider coming?
I would. Prague in April is probably not going to happen. But probably not Sydney either. I have 3 young kids, so it's hard to travel that far. But the next time it's stateside,
Boston.
sure.
Boston.
Boston. I love Boston. I love Boston.
So I think on that, I think there's a really important piece of work or thought to go into the fact that people who are not necessarily within lung transplant but are in allied specialties that might have an interest in the work that we do. Now, I work with a number of different people, as we all do. So I've got a colleague who I work with very closely in a research field who's an infectious diseases doctor. He's not a member of the ISHLT, but the meeting price is extremely off-putting for him, and that's before we've traveled to North America, etc. So those things are worth thinking about, because I think there is genuine interest, and certainly within the UK, transplant is one of those sort of things that happens in a very small number of centres, and unless you engage directly with the groups that are delivering transplant or MCS, it's a bit of a mythical beast, and people don't know much about it. So, okay. Now, Kevin, you're on mute, I think. No, still on mute. You've got a phone signal rather than a microphone.
I think it's your Bluetooth, perhaps.
You could type something into the chat.
Kevin, we can see your mouth moving, but we can't hear any sound.
No, and then Shambu Ariel, you at the bottom there, you've disappeared. How are you? You've disappeared.
Hello, everyone.
Hello. Okay. Okay. So I've not got an awful lot more. Oh, Jose, you might have something else.
Yes. Thank you for sending out the invitation. My name is Jose Gibert. I'm a respiratory therapist who is no longer working clinical, but I am a physician liaison for the Advanced Lung Disease Lung Transplant Program at the University of Florida in Gainesville. Our chief of thoracic surgery is worked in the UK, Mindaugas Rakakis. I don't know if anybody from the UK or the Dublin area or Toronto knows him. He's a phenomenal surgeon. Amir Imtiaz, who is the medical director of our lung transplant program at the University of Florida. Dr. Cynthia Greaves, who used to be at Advent in Orlando, is now the director of our fellowship program at the University of Florida. And Dr. Biplop Saha is also one of our transplant pulmonologists. I am going to Prague. My team wanted me to be there. And the reason I joined today was, one is I received the invitation, and I was very grateful for that. And 2 is I would love to meet all of you in person in Prague. And I thought today would be a great opportunity to at least get a name with a face. And if you have any questions at all, or if I can help facilitate connecting you with any of my physicians at the University of Florida, I would love to do that. Thank you all very much.
That's great. We'll look forward to meeting with you in Prague. Perhaps you can come to one of the meetings that I highlighted earlier. I think that's probably going to be the easiest place to connect. Okay, Shambu, we can see you now. Who are you?
Hi, everyone. Shambhu Ariel. I'm at Innova Fairfax in Northern Virginia, right outside of DC. It's good to see everyone. I just wanted to join and, get to know you all and network.
Will you be joining us in Prague?
Oh yeah, I will. Hoping to. Our travel packet has still not been approved, but the plan. Hoping to be there. Yeah.
Excellent. Hope to see you there. What can ISHLT do for you? What's on your wish list?
I don't know what's been talked about so far. Sorry, I joined right in the middle of the meeting. But no, I just hope to be, meet all of you that many of who I know on this call, but also ones that I haven't met. Go Duke, yes, Carolyn. But no, I find, of course, I shall be very, very informative, and just doing transplant and primarily where I work, just being updated. But also, I started a position of an associate editor for JHLT Open this year, so hoping to meet my colleagues, and that's another incentive.
Very good. Okay, Kevin, I think we've got your comments here. Can everybody see this? So I'll read them out. So first, I guess this goes to you, Greg. That you're on the spotlight today, but you're in the middle of my screen, so that's appropriate. So one is the consideration of offering a group membership for programs rather than individual membership.
That is being discussed. We just launched a membership committee. ISHLT had never had a membership committee until this year. So we now have a membership committee. This year we'll be piloting what's called an ambassador program that provides that establishes one person in each center as the sort of ambassador to ISHLT to make connections to all of the different members of the team. And if that pilot works well, I think we will be seeing group memberships coming available for institutions and centers in the future.
And how did that translate then into sort of opportunities for people to come to the meeting, that kind of thing?
Those details will be worked out as we move through this pilot program, but it may be a single payment and you get X number of members and X number of meeting registrations. And the idea is, of course, to extend the membership beyond pulmonologist, cardiologist, surgeon, and engage with the infectious disease people and the pharmacists and the nursing allied health people and the coordinators and so on.
Yeah, absolutely. And then Caroline here suggested day rates for the annual meeting.
Yeah, that's also being talked about. There's an annual meeting task force right now that is looking at all sorts of questions about how should the annual meeting evolve. And this is a sort of this is a low-hanging fruit question. So I think it's likely that we'll see day rates in the near future. Not in Prague, but in the near future.
Yeah, I mean, I think one of the things is that the focus as busy clinicians is predominantly on the annual meeting and the learning that you can get from the annual meeting received, but there's also a huge amount of work that goes in the background to sort of develop that and make sure that it's current and that we're developing standards and guidelines and all the rest of it. And I guess, I mean, I know there's feedback, sort of questionnaires and things that go out at the end of the annual meetings. What sort of feedback are you getting? How is that reviewed? How's the negative feedback looked at? What are people asking for? That sort of feedback needs to be disseminated amongst groups such as ourselves.
Yeah, that's a great point. We have not, and the surveys do generate quite a volume, a report, and that is typically reviewed by the executive program committee of the annual meeting, which includes next year's program chair, this year's program chair, this year's president, next year's president, and a few other people. But I think that it would be wise to push some of the key feedback items back to the professional communities. And I mean, that's where, that's where the grassroots of the organization is, and that's where people experience ISHLT. So I'm going to propose that we do bring some of the key findings back to these groups. And in terms of what they are, the negative feedback, cost and location.
Yeah. Okay.
Other than that, I'd say the feedback is overwhelmingly positive, but those are two consistent issues. And then another one is people who are shy or reluctant to speak up in sessions and are looking for a format that might make that easier. So we're talking about those things.
Yeah, which are always going to be barriers, aren't they? Which are difficult to overcome, other than by being friendly and hopefully encouraging people to get involved.
Yeah.
I just wanted to go back to Elias, thinking about the sort of the ECMO stuff. There's a lot of very big ECLS support, ECMO, that kind of work going on in different societies. How would a society such as yours, sort of feel about not necessarily integrating, but sort of setting up joint educational webinars, that kind of thing? Do you think there's an interest in the ECMO world for the work that we do within transplantation, or is it such a small part of what you do that?
Well, I'm at Duke, so there's no small part of the work that I do that doesn't involve transplant.
Okay.
So I would say that, it's something that I think there would be interest in, right? I think because transplant and ECMO intersect a lot, it's oftentimes the same surgeons, it's the same groups, right? So the question about when and where to use ECMO, not just in the immediate post-transplant failure, I think is of interest. We have a fellow who's actually doing a project right now looking at the use of ECMO outside the acute period, right? So if you're going to do it for a respiratory failure in someone with a lung transplant outside that sort of 30-day acute post-transplant window, what does that look like? Predictors of mortality. I've heard, this is going to be like a multi-center project. So I know at least within that community, there's a fair amount of interest, because as more places do transplant and more places do ECMO, these questions keep coming up. And so guidance on sort of when you should do this, when you shouldn't do this, when you should think about referring to a higher volume center. If you're talking about retransplant off of ECMO, that is a very specialized thing, and sort of considerations like that. So I think there would be general interest, because I think if you're at a place that does a lot of ECMO like Duke, you're almost by default at a place that does a lot of lung transplants too. Not always, but very often.
So I think lots of food for thought there. There's people saying things here. Damien, do you want to ask your question? No, you want to collaborate. Damien, you can speak.
Hello, can you hear me?
Yes. Perfect.
Hello. Yeah, good afternoon. Thank you for the invite. Sorry, I wasn't sure if my audio was going to work, because I'm just in and out of our bronchoscopy suite. So I didn't want there to be a lot of background noise. But again, thanks everyone for the invite and putting this on. Again, was invited by Dr. Lorenzo Zafiri, who I've worked with for many years. He's out at Cedars-Sinai, very involved with ISHLT. I am not an ISHLT member at the time, but again, at our center, similar to what's been said at Duke, same thing. Also member, do a lot of ECMO, MCS, and I work more with my transplant physicians day to day sometimes than my regular general critical care colleagues, because it's a lot of bridging with these patients, going on and off for both cardiac transplants and lung transplants. So I think historically things have been a little siloed, but I see the movement in CHEST and other organizations to kind of build the collaboration. So I do appreciate this. And I think it's a lot of the same physicians running in different circles sometimes. So I think any kind of welcome collaboration for education, patient education, you name it, and growth is, welcome. How you all tackle that, again, I'm open. And like I said, I was just wrapping my head around the invite that I got last week. So again, just excited, and thank you.
Is ELSO your primary place for ECMO?
Yeah, ELSO, and I think chest has become a lot more active in that arena. But yeah, that's again, just getting involved. I've been, again, boots on the ground doing the work for a number of years, but now just trying to get into this kind of area for more growth and building, because again, we work with our transplant docs all the time. And our units are kind of almost collaborative type of units. So they're doing the transplant piece, we're doing the MCS ECMO kind of piece. And I think at some of the larger centers here, that's how it is. So
thank you. Looking at the comments. ISHLT merch blingy pins. Yeah.
And there was a question from Kevin regarding the S&G. So yeah, Kevin, I had sent out kind of a feeler earlier, several months ago, when the S&G documents were being put together, asking for a list of volunteers. So we have collected that list, and that list will be sent on to the project leads. But I would encourage you, and to pass the word on, if you are interested in participating, I would also encourage you to go through the link on ISHLT Connect. There's an application link where you just fill in your information. That way, to be sure that information gets passed on to the leads. But we did share that list of names. But yes, please go through the official channels to express interest in participating as well. We had about 100 different expressions of interest across the 4 projects. So a lot of interest across the membership. And so the leads will be putting together lists of work group once they get all their volunteers.
So to finish that kind of loop, then what happens to the people who are not involved in the project going forward? How do we make the most of that enthusiasm and sort of get people involved in other things?
Yeah, it's a great question, Anna. I think having your name out there as being someone who's interested in participating is also a key first step too. Even if you aren't selected to participate in one of these, and to be honest, I'm not sure what the limit is on the number of people in each work group, but that kind of, those names then go into kind of a pool of people to reach out to the next time something like this comes around, or some other opportunity to get involved. You can reach out directly to people at that point, knowing that you've expressed interest in participating.
Okay, brilliant. So I'm going to plan to wrap this meeting up slightly early if there's no major burning questions. We've had just over half an hour, 40 minutes. So it's been really interesting, really useful to meet other people from other groups. I'm very pleased that you responded to the invitations, because it's actually really helpful to start thinking about how we can connect better with other groups and get more people involved, which I think is very clearly the kind of next big thing, isn't it, in terms of the society and getting us moving forward. Unless anybody's got anything burning to say.
I'll answer one more question, Shambhu's question about the pre-course, like ATS has. We've got, there's a core academy that comes before ISHLT. They're not being offered this year in Prague, and we're reworking that. There is a plan for a fellows course, fellows academy. That's definitely being talked about. I'm hoping we can launch that in Boston in 2025, or it might be standalone and separate from the annual meeting on kind of a rotating regional basis. Definitely in the plans.
That's great, because there's that meeting in Texas, like Grapevine, that happens every month, but it's across all abdominal, and it's got a lot of abdominal stuff. But for thoracic courses, I think it'd be really helpful now that more programs are doing having fellows.
Yeah, I was going to echo that. The one you're talking about, Shambhu, is the one it's AST that
Right,
runs
AST, yeah.
that one.
Yeah,
right?
I knew which one you meant.
Yeah, and like you said, it's very abdominal heavy, and so getting something that's thoracic focused would be ideal.
Okay, great. Well, good to see you all.
Thank you all.
Thank
We'll
you for
see
the
you
opportunity.
Thanks, Nani, for the great leadership.
No worries. I'll see you soon. Take
See
care.
you all.
Cheers.
All right.
Bye. Bye.